Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Marilyn Allen. Marilyn, why don't you just tell us a little bit about the symptoms that you were having before you came in to see us, and all the doctors and all the different things that you tried before you came
Sure.
in?
It started about a year and a half ago. Came home after a trip, and my lower back started hurting. And boy, it just cascaded from that to my sciatic nerve, and my foot would go numb. My leg was just felt very weird, and then it went into my whole right side of my body, and even into my head a few weeks later, which was very troublesome. And I found myself in bed a lot. I only would get up and go start crying. I would only get up just to eat and go back to bed. And it really worried me. I was going to a chiropractor, I was going to a DO, I was going to a rheumatologist, and I knew I needed something aggressive. And my chiropractor at that time, I said, Doctor, how often do you want me to see me? Because he would say, yeah, your leg is out of adjustment. And I was hoping he would say, well, come back tomorrow. And he would just say, well, come back when you need to. And it's like, well, don't you hear me crying for help? And it wasn't until about a year later when I was just exasperated because I was going to a neurologist who at the time was just, her prescription then was just to increase the medicine, saying that, well, that should help your leg and your head. And I would go back to her and say, it hasn't helped. And well, that's changed medicine. And it's like, no, I don't want to, because you look at the side effects, and I knew then that my body it doesn't like drugs. And so one night, about January or December of last year, I was on my phone looking at the internet, seeing what I could find, plugging in. I think I queued in sciatica, and I don't remember else, but Dr. Roadhouse came in. I thought, wow, you've got to be kidding me. And maybe my answer is only 2 miles away.
Well, and when a lot of patients get frustrated like that,
Oh my
and it's
gosh.
like, they usually come to us, excuse me, last, and by then so much else is going on. So, you came in, we did the examination on you, and we had the MRIs, and you had 2 bulging discs in your low back causing sciatica. You had 2 bulging discs in that causing into the shoulder up to the head, and then we found out that you had a thyroid problem and you were autoimmune. And from that testing, we found out, that you had leaky gut. So we've done the decompression on the lower back, and the lower back's doing good. The sciatica is better. And now we're rehabbing the lower back. We're doing the decompression neck, and we started the treatment for the leaky gut and the thyroid. So why don't you let them know, what's changed? I mean, you talk about the low back, the sciatica, and then, anything to do with the thyroid and stuff.
My leg has definitely changed. I still can't sit there very long because I guess I get nervous, not wanting to promote that feeling back again. So I can still that feeling, that sciatica is still twitching, and I know it's not, it'll take a little while, but my goodness, what a difference it has made. Also, my head is improving. I can't tell you all the myriad feelings in my head, but it is definitely changing for the better. I don't think about it 24 hours a day. Now I can do other things, and it's like, wow, my head is doing better. All of a sudden, I come to that realization. My gut is doing better. For a long time, I was eating those veggies, but my bowel movements were green, and I thought, well, maybe it's green in, green out. But it doesn't realize now it's due to the leaky gut, because then I started getting all these food sensitivities, and through Dr. Roadhouse then kind of opened my eyes what was happening. And now through your supplements, I really have noticed a change. I think I'm almost to week number 4 of taking the supplements, so my bowel movements have changed. And we're on the road, so.
Okay, so
I'm
what
encouraged.
about sleeping? How are you doing that?
Well, with my SI joint is now gone out. We're having problems with that for the last month or so trying to get that stable. So sleeping has improved if my SI joint is
Right.
cooperating.
Where before you couldn't sleep at all because, or
No.
not much. But the sleep that we've had is due to the pain in the sacral joint. The discs
Right.
are doing fine.
Right.
And talk about like your energy level and your hair.
Yeah, it troubled me for a long time to take a shower and wash my hair because there would be large clumps of hair, and it's like, wow, that went on for a long time. And now with the supplements on all the last 2 shampoos or the last 3 ones, there's been very minimal hair loss.
Yeah, so she's doing real good. She's in the beginning process like she says, she's just on week 4 because we're doing the cerebellum treatments, the oxygen and all the brain activation so that we could get a good decompression, and that's doing much better. So now we started on the metabolic. We did the testing. The testing was expensive, but it showed us where the triggers were, what the sensitivities were, what the genetic problems were. It showed us that you had leaky gut. So now we're focusing our attention on that, which is just going to speed up the healing of everything else. So we're going to check in with her, maybe in about 3 months, but she's had good results so far, and we're just going to keep going forward.
No, I appreciate all his comprehensive tests instead of looking just one aspect of this from a doctor, another aspect of this from a doctor. So I really appreciate that overall view.
Well, and that's why you're getting better, because you're going to these other doctors and they never did all the testing. I mean,
Exactly.
none of these other doctors, even the neurologists, never did the exam like what we did. You said it's so
not at
thorough.
all.
And also the lab tests, these are standard lab tests, but no one ever recommend those. And that's where, it gave us, we weren't guessing, we know exactly where your problems are. We've got you on a restrictive diet to, not take in those, not only the food sensitivities, the genetic foods that affected you, but also the cross-reacting foods, because remember you're having a little bit of trouble, so we did the cross-reacting test and we found out that tapioca, and you were eating
They realized how much tapioca, because I was eating the coconut yogurt, and that has tapioca in it. I found a yeast-free, dairy-free, soy-free, etc. bread, and that has tapioca in it. It's like, wow, who would know?
And that was her cross-reacting foods. So there's no way that you could have guessed that tapioca would have been cross-reacting that was still giving her trouble. So once we figured that out and we got you off the tapioca, that's when you really started seeing. So we could have been doing everything right, and had we not done the cross-reactive foods, you wouldn't have got the results you're getting right
Exactly.
now. Okay, good. Well, you just hang
Thank you,
in there.
doctor.
We're going to get this all fixed. Okay, I'm so glad you're doing good. We'll check back in with you in about 3 months.
Fantastic, thanks.
Okay, thank you.